I'm going to make one of my vice president, who is an ITX expert from Department of Financial Services, answer the question.
So yeah, so that pilot was implemented, and it didn't exactly work out the way it was supposed to, right? They wanted to take IT. What happened is they come in, they untested. They were supposed to augment the work. There was specific special expertise that they were required to have, but that's not exactly the way that management used them. So I'm going to say it was mismanagement of the way that brought in, and there was absolutely no consultation with the union. There was never a plan. There was never any strategic plan, no process or anything to how that they were going to work within the existing workforce. You know, I sat here today and I was listening to a lot of the stuff about a sustainable workforce and the workforce issues, and you know, I said to myself, you know, what looking glass are they looking for? Because all I heard today, and I'm not going to be politically correct, was a lot of smoke and mirrors. We do quality work. What's happening is there's a lot of mismanagement going on. As President Spence explained earlier, the process of creating OITS as an entity was to in-source, in-house a lot of the work. And what happens is our members are really being disrespected, they're being villainized, and they're not allowed to do what they need to do because of the management. Look how many commissioners or chief information officers, as they call them, that OITS has had since the inception. So it's a lot of that. When the top is kind of weak, you know, the card's down, and so there's no stability. So what this budget and increasing with bringing in the consultants is coming in, what they're really doing is they're creating an unstable workforce. And add into the health insurance where my existing members think that they need to leave by October or they're going to lose some of the benefits that one of the reasons that they came for. So you have such and when you're looking at the level 1 and level 2, and I won't even they'll go into it tomorrow about the security risks of taking that outside of the agency purview. They're worried about their jobs. You know, it's a long thing. People come in, they look for some career mobility, and I have to, you know, agree with Director Turner. A huge issue is the lack of staff at civil service. They can't do the testing. We have lists that have thousands of people on them. So tell me, and then you add in the skills survey that they did, the skills assessment, and all the tools that they claim they have. But she's working on succession with ITS. And the succession plan result is really to privatize. So what is the succession plan? Right. Succession is to privatize. They haven't looked at having a stable workforce. Someone here earlier talked about Jonas. Who was the first person to hit that street? It was a government worker. We were always out there, and no matter what disaster, natural or man-made, we're out there, we're doing the work day by day. And it just doesn't go with that on the back end. You know, the technology is being provided. Those services, if you work outside of the scope of what they're coming in as consultants, look at the exaggerated costs, because now you're paying emergency costs. So, you know, it all snowballs to the fact that really, because it's spread across multiple agencies and multiple jurisdictions, you really never get the true cost. And that's kind of something that we have to. So the insourcing at that time was good, but it did stem a lot of our existing employees from some career mobility, but it also wasn't implemented because PEF had no input in that, and that is why we had a pre-discussion this year, you know, where we were looking at it, but then again, PEF was written, so there was no collaboration or cooperation or communication between the SUS, and it wasn't used the way it was intended.
Well, perhaps we'll take another look at it. Thank you.
Assembly?
Yes. Mr. Avenatti.
One question. Tell us about the Justice Center.
So the story, sir, I want to give you this story real fast, Anadolu. I have a member who works for an agency that is not related to the Justice Center, but she's on the executive board of my union, so she hears all the horror stories of executive board members who talk about the injustice of the Justice Center as a state employee. She has a child who's in a special OPWDD setting. Her child was raped there. Her child cannot speak. She said that the Justice Center did nothing for her child. Because her child could not speak, could not communicate, the person who was obviously the perpetrator did not get punished. So I want to tell you, here is a employee, a PEF member, who hears all the time of nurses being let out in handcuffs by the Justice Center, who later is found not guilty, but then is told by the Office of the OMIG, Office of Medicaid Inspector General, that they're going to take her license away and put her on the Medicaid exclusion list. She could never work as a nurse again in the United States of America. And this person hears that story and then relates the other story of her daughter being raped in a home that's overseen by the Justice Center, and the perpetrator goes free. So then where's the justice? There's no justice for the people, the staff, and there's no justice for the clients or the consumer. So that's why I've coined it the Injustice Center. This is wrong.
Thank you. Senator Martins.
Thank you for your testimony here today and tonight, and thank you for your patience. You know, I'm struck by a common theme that we keep coming back to tonight. You know, when I reach out to my local DOT office, regional office, and we talk about the need to come out and look at a roadway that needs to be redesigned, or consider the possibility of redesigning a road, and I'm told that we don't have the skills to be able to do that in-house because people retired and they weren't replaced, I'm concerned. You know, as a former mayor, back when we take care of issues in our village, we made sure that we had people on staff who could do things, so that in the event of an emergency, we didn't have to rely on outside vendors to come in and do those things. And you know, I think there's a clear call today, not only in your testimony, but obviously in the testimony of others today as well, that we have to recalibrate a baseline for our workforce where we become self-reliant as a state, because if there's a theme that I am hearing, and I'm sure we're all hearing, it's that there are vulnerabilities now that the state faces that perhaps it didn't have years ago, and it's because we have a retiring workforce and it's not being properly replaced, and we're outsourcing that. And yes, we're doing that for the sake of saving dollars, perhaps, not always. But that knowledge is being lost as well. And when we do need to rely on our workforce to get the job done, to make sure that the road is properly designed, to make sure that the construction goes properly, or to make sure that those people in care that are most vulnerable are actually properly being cared for, and we pick up the phone and we make the call to the consultant, they won't be there, but that public employee will. And so I thank you for your testimony.
Thank you, Senator Martins. Again, it's the old adage, we said, penny wise, but a pound foolish. Because what's going to happen is that on a lot of these things, my kids, your kids, our grandkids are going to end up paying for this in the long run. Again, we rely on consultants to the point where, if you look at the ITS example, it was a consultant 2 years ago where the state spent millions of dollars saying, combine this, take it away from each individual agency, combine it, and you will save money, and you won't have to rely on consultants anymore. But yet 2 years later, we went from 164 to over 800. So we are now relying on outsiders who are consultants, who are basically telling us that, help me help you so you don't have to rely on us. But it's almost like a Ponzi scheme. They do it in such a way where then they bring their friends in after they recognize, oops, we got it wrong. Guess what? It didn't go the way we actually thought it. But guess what the fix is? More consultants.
I appreciate it. Thank you very much. And I hope you don't, and none of us have to wait 10 days for a call back to deal with an IT issue.
Thank you.
Thank you very much for your testimony today. We appreciate what all of your members do on behalf of the people of New York State. I also want to personally thank you for your comments about treating the mentally ill. Very important issue. And, but all of your comments were very well put and very valuable as we go through this process. So thank you so much for being here, President Spence, and to everyone who joined us today. So thank you. Our next speaker is the Organization of New York State Management Confidential Employees, Barbara Zeron, President.
Good evening.
Good evening.
Chairpersons Farrell and Young and members of the committee, we thank you for the opportunity to speak. You have our written testimony, which addresses some of the issues that you've already heard about. I'm going to confine my remarks to what is, for MCs, the most important priority. I'm going to give you just a bit of history. MCs in 2009 had their statutorily approved salary increases withheld. Same thing happened in 2010. They certainly were aware of the 2008 fiscal crisis. MCs are one of the bargaining units that constitute 6% of the workforce. They did then, they do now. This has been true for about 40 years. They were the only unit that had their previously authorized salary increases withheld, and they still have not been paid those increases. In 1973, MCs lost the ability to do collective bargaining, and so here we are before the legislature asking for your help once again. We've had very good support from members of this committee, from Chairman Farrell, former Finance Committee Chair DeFrancisco, in helping us to pass legislation that would address this issue. But here we are once again. MCs went without any salary increases for 5 years. The salary disparity between the MC supervisors and the people that they supervise continue, and many MCs are earning as much as $10,000 or more less than the people that they supervise. So our advocacy today is not about new money, it's not about raises. It is simply that we believe this debt, which is still outstanding, needs to be paid, and that the MCs should not have to wait until March 31st of 2019, which is the schedule implemented in last year's budget for payment of these monies, should have to wait 10 full years from the time the money was taken away until they get the money paid back. So there's a lot of buzz that we hear about parity, equity, workplace fairness. That all rings hollow with the MCs because they still have not gotten paid that 7% that they were supposed to. So the 2015-16 budget adopted a 4-year schedule. They did get 2% last year. They're scheduled to get 2% this April, but that still leaves an additional 3% to be paid next year and the year after. That just is too long. The MCs are angry, they're frustrated, they're scared. They feel they've been abandoned by their employer and that they're going backwards instead of forwards. Everybody else has gotten this money and they haven't. So what we're asking for is full restoration of what is 5%. 2% built into the budget for April 1st, and an additional 3%, which would mean $33 million to be added to the budget to pay the full 5% outstanding. You heard earlier that the state has started negotiation with some of the unions, and any salary increases that are negotiated would further exacerbate the salary disparity caused by the MC withholding unless such increases are also applied to the MC employees. They usually are, but who knows? Then we have a number of retirees, over 3,000, who retired between 2009 and 2014. They are not eligible to get any of this 7%. So they have suffered and will continue to suffer permanent pension reductions due to the withheld salaries. Their pension benefits, their Social Security benefits, and the value of their sick leave, which is used to pay for retiree health insurance, have been permanently diminished. We have legislation that we're proposing. We're calling it the Withheld Pay Pension Adjustment Act to remediate a part of the loss suffered by the MC retirees. Further details are in the written testimony. We should also note that almost 80% of state and local retirement system retirees remain residents of the state, so that any additional amended pension benefit would come back to the state. And the retirees obviously are an integral part of our state's economy and really deserve better than they're getting. To add insult to injury, the rehash of old attacks, which you've already heard about, on the civilian retiree health insurance and Medicare reimbursement has been rejected by the legislature in the past. We urge you to reject these proposals again this year. During his recent State of the State message, Governor Cuomo quoted former U.S. Vice President Hubert Humphrey, who said, "The moral test of government is how that government treats those who are in the twilight of life, the elderly." Senator Marchione has talked about senior citizens. Here we are. So we need your help. We need the additional 3% added to the budget this year to pay off this 5% debt that's still outstanding. We need, probably after the budget, we will be coming to you with the pension amendment legislation for those who had the salary increases withheld, and we urge you to reject the continuing attacks on health insurance and Medicare reimbursement. And we will be happy to answer questions or make appointments to see you at a future date so we don't stay here through the night.
Thank you. Any questions on these?
Thank you.
I don't think we have any questions on our side, but your testimony is very comprehensive. We truly appreciate it, and we really appreciate you hanging in there for so long. So thank you so much.
It's important. It's important to us. This is an issue that's absolute top priority for our members. So we felt we really needed to tell you once again, this is the 7th time we've had to come before you and say this is a problem that still hasn't been fixed. And I know I would like to be talking about other things. I'm sure you would also like to hear about other things from us, but we're going to be here until it gets taken care of. So,
thank you.
And we appreciate your time and your patience.
Thank you very much.
Thank you.
Good night. Next, Retired Public Employees Association, Jack McPadden, Board President and Company. Oh, I'm sorry, and Edward Farrell, Executive Director. You get closer, Ed, and I see who it is. Thank you. So welcome. Looking forward to hearing what you have to say.
Chairwoman Young, Chairman Farrell, members of the Joint Fiscal Committees, thank you for the opportunity to speak to you this evening. You have a copy of our testimony, so in recognition of the length of the day, let me summarize. The governor's executive budget proposes language that, if adopted, would result in significant premium increases in health care benefits for Medicare-eligible retirees enrolled in the New York State Health Insurance Program. Medicare-eligible NYSHIP retirees pay the exact same premium contribution as their counterpart active state employees. However, they also pay a Medicare Part B standard premium, and for some higher income retirees, a Medicare Part B and Part D income-related monthly adjustment amount surcharge. Recognizing the unfairness of this additional payment, the legislature provided for full reimbursement of all Medicare premiums. Chapter 602 of the laws of 1966 created Section 167A of the Civil Service Law to offset these additional costs to the enrollee so that the enrollee's total cost for their health insurance would remain unchanged. The governor proposes capping the reimbursement of the Medicare Part B premiums to $104.90 per month starting on October 1st of this year, despite the fact that Social Security has raised the standard Part B premium to $121.80 per month for certain Medicare recipients. If there is a Social Security cost of living adjustment next year or in future years, the Medicare Part B standard premium of $121.80 per month would apply to all 145,000 Medicare-eligible retirees enrolled in NYSHIP. This would mean $16.90 per month of the Medicare Part B standard premium would be borne by all Medicare-eligible NYSHIP enrollees as an additional out-of-pocket cost totaling almost $30 million annually. The executive budget is blatantly misleading regarding this most likely reality. Now, as he proposed in 2 of the last 3 state budgets, both times thankfully rejected by the legislature, the governor's plan would also eliminate the Part B IRMA surcharge reimbursement. This surcharge ranges from $42 to $398.80 per month out-of-pocket cost for each retiree. The governor continues to deny reimbursement of the Medicare Part D IRMA surcharge for prescription drug coverage, claiming that the civil service law does not apply to prescription drug coverage. This surcharge ranges from $12.70 to $72.90 per month out-of-pocket cost for each retiree. There is legislation sponsored by Senator Golden and Assemblyman Abate, which had passed the Senate last year and was reported to the Senate Finance Committee last week, that would correct this inequity. We also urge you, as we did in last year's testimony, to pass a measure affirming that it was not the legislature's intent in 2011 to allow union-negotiated increase to the premium contribution percentage paid by active NYSHIP members to be passed on administratively to existing retirees. In the last round of contract negotiations, administrative authority was given to the Director of the Budget and the President of the Civil Service Commission to modify NYSHIP statutory contribution percentage rates. This is an equity issue. How can union negotiations affect those of us who have already retired when we are not a party to the negotiation, nor are public employee unions allowed to bargain on our behalf by law? This bill was also referred to the Finance Committee last week, and we urge its favorable consideration. Thank you for allowing us to testify this evening on behalf of all public employee retirees, and we'd be more than happy to answer any questions.
Thank you very much.
Thank you.
I think we're all set. So thank you so much for being here tonight. And again, thank you so much for your patience.
Thank you.
Thank you, Senator.
Next, right on the 5 minutes too. Kudos from Assemblyman Oaks. Our next speaker is Randy Wolkin, President and CEO of Manufacturers Association of Central New York. Welcome.
Thank you.
Thank you for the opportunity to speak this evening. My name is Randy Wolkin. I'm the President and CEO of the Manufacturers Association of Central New York, MACNY, as well as the President and CEO of the Manufacturers Alliance of New York State. MACNY represents over 300 companies in 26 counties throughout central upstate New York, and the Alliance represents over 2,000 industrial companies and businesses all over New York State. You should have a copy of my written testimony. I'm going to actually offer some brief comments specifically on the governor's proposal for a manufacturing-focused apprenticeship program, which is termed Apprentice SUNY. And we're pleased that it's included in the governor's proposal, but we have some following recommendations so that the program is a success. MACNY recommends the creation of a manufacturing intermediary apprenticeship program for New York State. You know, New York State manufacturers, especially the advanced manufacturing industry, faces a growing increase in the demand for skilled workers. In 2013, approximately 115,000 people were employed in the advanced manufacturing industries, which really is 1 out of 4 total manufacturing jobs in New York State. Just 3 industries account for 50% of those jobs: electronic instruments, semiconductor, electronic components, and pharmaceutical medicines. Together make up that 50%. You know, the average age of these high-skilled workers is now 56, and replacing them before they retire is critical to retaining these jobs and the skills necessary in our workforce. You know, the majority of New York State manufacturing, even in those sectors, is small and medium, and they don't have the personnel or the resources to adequately train their new and specifically their incumbent workers, especially in the skilled positions. This proposal actually targets the ability to use entry-level workers and advance them into more skilled positions within a company. You know, this effort would be an employer-led public-private pilot program for registered apprenticeships in manufacturing occupations. It would be a unique business-led approach targeted at raising the skill levels of our incumbent manufacturing workers to create pathways to fill those critical needs. You know, modern apprenticeships today really, as we know, have 2 components. The first is on-the-job training, which usually is about 2,000 hours a year, consisting of the master or journey-level craftsperson, which are currently in our manufacturers, and their willingness to share their experience with a novice or apprentice in a hands-on manner. There's a second related learning, which is the related instruction, which is at a minimum of about 144 hours a year. And that learning is more theoretical and knowledge-based, as we know. And usually it's done in a classroom or another testing site, removed from the actual workplace. This program would rely on the SUNY curriculum developed with the most recent completed Trade Assistant, Adjustment Assistant Community College and Career Training Grant, which is a mouthful we'll call TAC from now on, to construct an apprenticeship in a series of competencies related. This proposal would create the Employer Education Council to do that work to make sure the curricula are aligned with, especially for that related instruction. Registered apprenticeship programs are typically 3 to 4 years, to remind you, and the duration would be composed in the program that we're talking about. You know, we've been working with the New York State Department of Labor to obtain conceptual approval to be the single program sponsor and act on behalf of small, medium-sized manufacturers. You know, it's never been done in New York State. It's being done in other states, by the way, and would reduce dramatically the administrative burden on manufacturers, specifically small, medium-sized manufacturers, and would greatly streamline the apprenticeship program registration. This design would allow New York State Department of Labor to have a single point of contact for multiple employers, thus reducing the administrative burden. The design would allow small and medium-sized manufacturers to offer registered apprenticeship programs through an organization like MACNY as the business intermediary, and really alleviate their need for each manufacturer to go through a lengthy and complicated registration process on their own. This innovative approach provides for hundreds of employers the flexibility to hire in small numbers of apprentices. This proposal leverages the relationships that already existed and were created through the SUNY Tech Grant in advanced manufacturing, and it really would leverage that already important spending. You know, through the Tech Grant, already we've created new certifications and degrees to include certifications in advanced manufacturing, plastics, CNC, precision machining, optics fabrication, semiconductor technology. We would use all that in this current approach, so very little curricula has to be redeveloped. You know, this particular approach would be a multi-year effort over 5 years. It would cost about $6.8 million over the total 5 years. We'd like to start it with 1-year funding of $500,000. The New York State Department of Labor has been supportive of our approach. We've been working with them to address implementation. Manufacturers trust us. It's been demonstrated over our 102-year history, and we could bring additional small, medium-sized manufacturers to the table to make sure that this happens. You know, we believe that apprenticeship programs, if they're going to work, are going to require a group like ours, a business intermediary, to make sure that we can take advantage of this. We'll work with, obviously, the Department of Labor and SUNY, but they wouldn't have the same connection that organizations like ours has throughout the state. It would focus on manufacturing, which is absolutely critical, and it would aggregate the demand of small, medium-sized manufacturers, which are really the majority of manufacturing in New York State. It would use demand-driven curricula from the industries themselves on a statewide basis, and it would allow for the interaction with community colleges and others to provide the specific work that's necessary, which can accommodate through this approach, shift work, and other ways in which work gets done today. And we also would be working with national associations that use these industry-recognized credentials. So I'm going to stop there and take any questions you might have. And I appreciate, again, the opportunity to talk about this.